Jesse, so healthcare is one industry where AI is growing especially quickly. You've already alluded to this. And the promise of AI seems especially bright in many ways, right? From improved patient outcomes and diagnoses to personalized medicine to the accelerated development of certain drugs. At the same time, we have seen, coming out of a pandemic especially, right, a great demand for doctors, nurses, and other healthcare workers. And that is only going to grow as our population ages. So do you think that AI can and should complement existing healthcare workers, or is there a danger that there'll be displacement and job loss? And tell me a little bit about the quality of the jobs, especially in light of the rapid change in AI.
All great questions. And so the AMA has promulgated this concept of talking about AI as augmented intelligence, not artificial intelligence, because we ought to be boosting the capabilities of our healthcare teams, our physicians, our nurses, other people who are a part of delivering healthcare in America today to help them reach their fullest potential, not replacing them. And it's interesting, this whole concept about fear. We did a nationally representative sample of US physicians in August, and 40%, 4 out of 10 US physicians today are equally excited as they are terrified of AI. And we need to make sure that we have a regulatory framework and we have an approach from government and industry working together to make sure that we have tools that we trust. And if we lose the trust of consumers, patients who are on the receiving end of the diagnostic modalities that are being improved, if we lose the trust of the healthcare teams that actually have to walk into an operating room and use a device that has an AI algorithm in it, then there will be a huge setback for what we have to do, which is improve the efficiency and the ability of our healthcare system to function. We've got a healthcare system in crisis. Has anybody here tried to find a new primary care doctor lately? Yeah, good luck, right? And that problem isn't going to be solved overnight by expanding our training programs, expanding nursing schools and medical schools and residency programs. We need to do those things, and we're appreciative of any federal efforts to help with that. But we also need to use these technologies to re-engineer how we deliver care and make it ways that's more accessible to a broader range of patients and make it more affordable, but also make sure that we have the physicians and nurses and healthcare teams' voices at the table as these technologies are being designed so that the technologies are an asset, not a burden. We've learned that lesson, unfortunately, in difficult ways with electronic health records, the #1 dissatisfier of healthcare teams for many, many years running because they weren't usable. They were painful, they were difficult, they weren't implemented well. We can't let that happen with the AI digital health technologies that are coming online.